Go ahead.
Okay. These are some handouts on what I'm going to be doing today. Um, so you can feel free to read over those and take those home afterwards and use them. Um, so let's get started. First off, I want to ask you guys, does the phrase blood glucose sound familiar to anyone?
No, not really.
Someone.
Okay. So are you familiar with what it means? No idea what it means?
No,
No.
not really.
Okay. Well, what blood glucose is the amount of sugar, because sugar and glucose, sugar is the glucose. It's the amount of sugar in the blood of a human or animal. Um, so what I'm going to do today is check a blood glucose level. I'm going to do that by using one of the home kits. It is, the one I'm going to be using today is a One Touch Ultra 2. This is not the only type of glucose meter there is. There's different types and brands. They're available anywhere from pharmacies to supermarkets. You can get them from your doctor's office. Pretty much anywhere, any healthcare um, store will have these little gadgets. So that's what I'm going to be using today, which is it's a glucose meter. Yes, ma'am?
Is there a certain amount of sugar that's always supposed to be present in the body?
Well, the amount it's supposed to be from the low 100s to the mid 100s. It can be right under 100, but maybe like the 90s or 80s to the mid 100s. It's never supposed to be over 200. It's pretty much where it should fall. If it's over 200, then you should seek help from a physician. Okay.
Okay.
Um, so I'm going to be using the meter. Also, I'm going to be using a lantern device. Um, the lantern device is what you're going to insert the lantern into. I'm going to open it. There's a lantern here, which is where the needle is. On this device, there's a setting. You would choose what setting you're going to use. The higher the setting is for the thicker the skin. So today I'm going to use a 6 on Wanda. Also, the testing strip. This is the strip that you insert into the meter. At the top, there's an opening. That's where the blood goes. So you insert that into your meter, and it comes on.
What's the setting?
Well, particularly this one, you insert the strip, and it comes on, and it says apply blood. So it's just waiting for me to prick the patient and apply the blood. Um, but first off, you clean the skin with an alcohol pad, and then there's a bandage. So I'm going to go ahead and get started. So first off, I'm going to go ahead and clean her finger really good. Okay, I'm going to allow that to dry. I don't want it to burn or anything. Then I'll stick her. Okay, you're going to squeeze the finger so that the blood comes out. You want to get a generous amount of blood. I'm applying a good bit of pressure to make sure the right amount of blood comes out. So I'm just waiting to get a good amount of blood from Wanda. Just tilt your hand a little bit.
I
So this
guess
is a pretty good amount of blood.
if you don't get enough blood, then you have to do it again, maybe.
Yeah, the machine will tell you there's an error. Then you'll have to do it again. Okay, so her blood level is a 117, which is normal. 117 is normal. It's in that range. It's not really a mid 100 and it's not a low 100. So it's a really good range. Um, After you've gotten the blood off of the patient's finger, then you can apply a bandage to prevent it from bleeding all over the place. So that's what I'm gonna do. Is apply a bandage. Okay. And so like I said, 117, that's a normal. That's a pretty normal range. Um, and if the patient doesn't have a normal range, if they have a low reading, then what you're gonna do is you can give them a cracker, you can give them some juice to kind of boost that up or bring it to a pretty normal range. Some patients are required to eat before taking their blood sugar. It's about 15 minutes before you take the test, and then you would check it. These are normally patients that have to take their blood sugar every day. Um, Patients that don't know that they have problems with their glucose, what you would take is what's called a random, which is what I took today. It's a random. I didn't ask her how long it's been since she's eaten because we don't know that there's any blood glucose problems. If a patient has a higher, more on a higher side, then what you're going to do is just to suggest that that patient goes to see the physician because there's the indication that there's a problem somewhere. Um, Usually, doctors will try to adjust the patient's diet or ask them to increase exercise, which will help. What happens is if the patient has two consecutive readings of 200 or more, usually they're diagnosed with diabetes mellitus. There's two different types. There's a type 1 and a type 2. Type 1 is an insulin dependent diabetes, and a type 2 is a non-insulin dependent diabetes, which is more common. It's more common to have a type 2, but there are cases of type 1 out there. And what insulin does is it breaks down the fats and carbohydrates in the metabolism in the body. And if your insulin isn't working properly, then it just causes everything to be out of whack as far as the blood is. But as far as the blood glucose goes, Wanda's fine in my eyes. Once she goes to her doctor, he'll probably take a blood glucose again and, he'll determine that further. But that's really how you take the blood glucose reading. You just use the home kit. Anyone have any questions?
Yes, I do. Um, uh, if you would have taken her blood glucose reading and her blood sugar level was low, um, you would have probably given her a cracker or some juice or something to drink. How long after that would you take her blood glucose reading again?
Yeah, I would have gave her a cracker or some peanut butter or juice, or you can give them a peppermint, and then you'll typically wait at least 15 minutes. You can wait a little bit longer than 15 minutes, but you would typically wait about 15 minutes. Okay. Anybody else?
What are some of the warning signs that your glucose level might be a little high or a little low?
Well, when a patient has low sugar, they're weak. They experience weakness. Um, if they have a high glucose level, sometimes there's weakness. They can go into a coma if it gets too high. So you want to watch that. Yeah. Anybody?
Yeah, when their blood glucose level is low, um, is is their skin sometimes clammy?
Is their skin flaming?
Yeah, clammy. What I mean by that is when you touch the skin, it's sort of damp, wet.
They sweat. Yes, they're sweating. Sometimes there's a smell. If not when it's low, but when it's high, you'll smell them sometimes. Some people refer to it as a fruity smell. Personally, I smell acetone, which is something that your body makes. Um, there's also urine. Their urine smells a certain way. It's supposed to be a fruity smell in the urine, and that's normally a indication that there's a problem in the glucose level. So, anyone else have any questions?
No.
All right. Well, thank you. That's all I have for you today.